I'm Marvin Plackett, and today is Thursday, September 3rd. Greetings to all residents, to all staff, and to all guests. So at this time at Episcopal Homes, we have 32 active COVID cases. 24 are residents and 8 are staff. And all 24 residents, they are at Episcopal Church Home. And the staff, of course, are at home recovering. And 7 of the 8 staff are ones that are regularly scheduled at Episcopal Church Home. So that is where the spread occurred. Now it's a few weeks ago. Fortunately, over the last several days, we have been doing a lot of testing, and the tests over the last few days have all come back negative. So we're very pleased about that, and of course the numbers overall, the active cases, are declining some. So we're on the right trend right now, and we are very hopeful that that trend continues, and of course that everybody recovers. And once again, a reminder that the statistics are always on our website, episcopalhomes.org, and you can see the current statistics at any time, that 24/7. While we're certainly very sobered by the fact that 3 weeks ago we had this significant spike in cases, we're very pleased that over the last few days the numbers are coming down, that the trend is in the right direction. Very pleased about that. I want to once again put this in perspective, that at Episcopal Homes we have 10 communities, and only at one of our 10 communities are we experiencing this trend, or this significant increase, this spike. Only at Episcopal Church Home. At the other locations, we don't have any cases. We did have one case at Cardi Heights recently, but that has resolved. That resident has fully recovered, and they are no longer in quarantine. And so we're pleased about that. So once again, 9 of our 10 communities, we do not have any cases. It's only in the one right now, and fortunately heading in the right direction. As I've mentioned before, the symptoms, they're the full range. Some are hospitalized, a few have died, as I have mentioned in the past. And then of course there's a good number of those that test positive that have no symptoms. So it's the full range, and of course one never knows. You don't know how you're going to react to it if you get it. I don't know how I'm going to react to it if I get it. Maybe we're all optimists. We believe that we're going to have no symptoms. Well, if everybody's an optimist, that means some are wrong, because some have died and some have gotten, of course, very sick. Some ended up on ventilators. Some ended up in hospitals. The full range. Fortunately, at the Gardens, we continue to be free of COVID, and again, testing is continuing at both Episcopal Church Home and at the Gardens. So a great deal of testing continues, and that will continue for the foreseeable future. I want to make reference to a couple of articles in the Star Tribune. So 2 days ago in the Star Tribune, an article called Minnesota crosses troubling COVID-19 thresholds. State Health Commissioner Jan Malcolm said there are signs of COVID-19 growth statewide, and that Minnesota has overlooked the risk of viral transmission in family and friend gatherings, compared with supermarkets and stores where mask wearing and social distancing have become the norm. These informal gatherings have proved to be a weak spot in our collective statewide response to the pandemic, said Malcolm. Malcolm urged people to re-educate themselves to the basics. And this is what we've been stating over and over. 4 basic things: mask wearing, social distancing, staying home if you have symptoms, and hand washing. It's those 4 basic things. Minnesota now has a new case rate above the national average. State Infectious Disease Director Chris Ersman said group outbreaks at weddings and barbecues generally result from a lack of compliance with safety measures that often are followed in retail and public spaces. When people are not following those rules, that's when we're seeing the transmission. So, here we have a 3-day holiday coming up. It's Labor Day, and there's going to be a lot of family barbecues that are planned. and there's going to be weddings, etc. Remember, the virus doesn't care if you're at work or at church or at play. If the virus has an opportunity, it's going to transmit. And so, as stated in this article, it's vital that we maintain those important measures at all times, wherever we are at, wherever possible. Social distancing, wearing a mask, staying, or I should say, stay home if you have any symptoms and get tested, and then washing your hands. So those are the key measures that we always need to have in play, that we always need to be following. An op-ed piece, so an opinion exchange was written yesterday and printed in the Star Tribune. The title is "How Great a Killer is COVID?" Posing that excellent question. Okay, this article is by Peter Marshall and Dave Haig. So I'm just going to jump in the middle of this article. So let's compare it. On the bloodiest day of the Vietnam War in 1968, 246 U.S. soldiers died in combat. The nation's terrible opioid crisis claimed 137 lives per day last year. Auto accidents took 106 lives a day in 2019. COVID, by contrast, is killing close to 1,000 Americans each day. Here's what's really frustrating, the authors are saying. Reducing the COVID death toll doesn't require costly measures or a technological miracle. It doesn't require the nation to mobilize for war. It doesn't require invasive medical procedures. It just requires more people to wear masks, to avoid large social gatherings, and to separate by 6 feet or more. Profound advice, simple advice. I should say profound statistics. How deadly is COVID? Look at that comparison. That's significant. Okay, so I want to wrap up by just saying, be diligent, be vigilant, take care, love yourself, love those that are in your family, love your friends, take care, wear the mask, stay 6 feet or more apart, frequent hand washing, and stay home if you're sick. Take care. I wish you a rewarding 3-day weekend. Wish you health. I look forward to seeing you on Monday afternoon at 1:45. No, Monday I won't be doing it. Thank you. Thank you. I will not be here on Monday. It's a holiday. So you actually will not see me until Thursday. It'll be a week from today that you see me next at 1:45. Take care, everyone. Bye-bye.